Welcome everyone to our March 30th webinar, Winds of Change, a Chinese medicine perspective of Parkinson's disease. We're delighted to welcome Dr. Robert Bibeau. He's licensed as a doctor of Oriental Medicine, and he holds a Master of Science of Oriental Medicine from Southwest Acupuncture College in Santa Fe, New Mexico. And he's a diplomat of Oriental Medicine, certified by the National Certification Commission for Acupuncture and Oriental Medicine. And I just learned today that he just completed his doctorate of acupuncture and Chinese medicine from Pacific College of Health and Science. Congratulations. And Dr. Robert Bibeau is a former captain in the United States Marine Corps, and he served as an infantry officer in Iraq. He was wounded in action in 2008, and he received the Purple Heart Medal in result. This event triggered his journey from warrior to healer. Dr. Bibeau is active in the veteran service community and is currently serving as a national surgeon of the Military Order of the Purple Heart, advocating for veterans' health-related issues throughout the country. Thank you so much, Dr. Bibeau. You have an extensive and very interesting background, and we'll let you take it away.
Thank you, Casey.
Welcome.
Thank you all for allowing me to take some time to talk with you today. I've really been looking forward to this. And one of the things I really like to do in Chinese medicine is advocate for the medicine. And the best way to do that is really to educate about the medicine. So opportunities to I guess, demystify what this medical tradition is and help identify why it's effective is really, something I really enjoy doing. And I really pride myself as an integrative practitioner. So it's really clear that patient outcomes are much higher with the integration of these Eastern modalities with biomedical and Western modalities. So we do see that, and the evidence for this is really fantastic. In the last 25 years or more, the number of studies on Chinese medicine throughout the entirety of the medical tradition, there's considered to be 8 branches of Chinese medicine. We'll talk about that a little bit. But the amount of detail in these studies and what we can glean from them is quite clear in terms of how patient outcomes are better. There's still a lot to learn about why they're better, but we see the same thing in other fields of medicine. We don't always understand why a thing works. We like to understand the mechanism of action, but even then, I mean, you'll find for many Western pharmaceuticals that the mechanism of action is not well understood why a thing works. And we're finding that across all medical traditions, this is a more and more common thing. We can see that a thing does, but not always why. And that's indeed a key focus of Chinese medicine, is that it works. And in a book by a guy named Ted Kapchick, who's a Oriental medical doctor and wrote a book titled The Web That Has No Weaver, he talks about that the Chinese worldview, at least pertaining to medicine, doesn't really care why it works, just that it does. And so this is something that can be hard for us to kind of grasp is that, who cares why it works? Just, it's nice to feel better. Yeah. So that's an interesting detail and something I love to be able to kind of talk about and demystify. As we move forward, I really would love to be able to entertain questions that are out there. So I'll kind of give us a baseline of what Chinese medicine isn't, what Chinese medicine is, and how that pertains to Parkinson's in particular, or at least movement disorders, and what the Chinese perspective, the medical lens of Chinese medicine, how it views movement disorders. And then it'll be great to just kind of take it away with questions, because I do think that any questions you have for me, I mean, it's a great way to be able to get you to find someone that's out there in your area that might be able to treat you, if we can just talk about, hey, this is what you can probably expect if you go in for treatment. So first, let's talk about what Chinese medicine is not. It's not a cure, usually. Well, it's just not a cure, right? It's a treatment modality and an adjunct, but it's not a cure. It's not a panacea. It's definitely not magic. It's not shamanism. It's a medical tradition, and it's none of those other things. It is an ancient medical practice with a well-documented history, preserved texts, methods and traditions, practices and techniques, all of which were maintained and transferred to new generations and improved upon over thousands and thousands of years. Chinese medicine contains the oldest continually referenced medical text in the world, which is the Huangdi Neijing, which is translates as the Yellow Emperor's Journal Medica, usually considered to be of internal medicine. This document was produced somewhere between, I think, 440 and 340 BC. So it's truly an ancient text, and it is the foundational text that we utilize in Chinese medical training today. It's it's one of these things where you keep the tools that work, right? If you were to imagine, maybe your own toolbox at home, if you just, if you've just got a junk drawer full of things that you have built furniture out of as you ordered it from IKEA, okay, those tools are fine. But think of the tools like maybe in a woodworker's shop. He might have a few in there that are broken and don't work, but he kept them because his granddad gave them to him and they're sentimental. But he doesn't use them anymore. He's just got them. But the tools that he keeps and that he uses are the tools that work, right? You don't keep things that are not effective. So a medical tradition that is at least 5,000 years old, we would not have kept and preserved and passed on if it just simply did not work. So that's an interesting thing. Now, Chinese medicine, although it has this ancient text that is continually referenced, it also embraces new information and new technology, and it's done so throughout the ages. Simple things as the advancement of how you fabricate your acupuncture needle, and the other tools, all the way up through assessing and esteeming new diagnostic methods, such as at the turn of the 20th century, X-rays, and even to those Chinese physicians at that time, at the advent of biomedicine, with the advent of penicillin and these other antibiotics and so forth. They were looking at this and considered it part of their herbal pharmacopoeia. Which is fascinating. I mean, so that, for example, there's a product called winter watermelon frost that is often used to treat like aphthous ulcers, maybe on the tongue or inside the mouth. This is basically a frost, as they say, or in essence, it's a bacteria or bacterial colony that's harvested off of melon rinds, which is not particularly unlike the initial advent of penicillin in observing bacterial growth on citrus, right? So this is a pretty fascinating thing, that the Chinese were viewing the advent of biomedicine as just an addition to what they were already doing. They didn't really see it as a separate thing. And indeed, several formulas that we use, particularly in the treatment of wind, which would be how we view tremor of any etiology, they're relatively modern, and by that we mean somewhere between 1920 and 1950 productions or formulations. So it's really neat to see what about 100 years ago, how they were viewing the advent of these newer medical modalities is just the next shift in what they were already doing. So that's a pretty neat thing. Now, as I mentioned, I thought it'd be good to talk about the different methods within the medical tradition. Acupuncture makes up a relatively small portion of the medicine. There are 8 branches of Chinese medicine. These include acupuncture, of course, herbal medicine. It also includes nutrition. So again, not that dissimilar from what you may find in Western medicine. Now, the nutritional modalities in Chinese medicine incorporate the same principles and modalities as herbal medicine includes. So basically, how do you define what the effect in the body will be predicated on, this herb has these properties and this food has similar properties, and so what will the effect be? And this is indeed very much the idea that food is the best medicine. Chinese medicine also includes physical therapies such as Tuinao, which is Chinese massage, and Tai Chi and Qigong. One thing that Casey and I asked Casey to make sure that she reminds me just in case I get off track and forget, but we have seen unequivocally that exercise is beneficial to movement disorder patients. And why would this be? Right? It's pretty clear actually that exercise has a clear effect on the production and uptake of dopamine and helping in regulating the dopamine and acetylcholine imbalances that characterize movement disorders. So the question then becomes, how do you dose exercise? How much exercise should you do? Why do runners get a runner's high? Right? It's because of a profound release, I guess we'll say, of dopamine and serotonin. And so this creates that sense of euphoria after running many, many, many miles. Well, these events are pretty well understood. So if you've got Parkinson's and you start dosing to an effect that is no longer therapeutic and in fact maybe becomes toxic for your life, well, that's probably not any good. And how did the Chinese kind of deal with this? Right? They didn't understand it in the same terms that we do. They didn't define the phenomena in the same terms, but they did figure out how to dose exercise. And this is when you practice Tai Chi or Qigong. And an important thing to understand about Qigong, all Tai Chi and all Kung Fu are types of Qigong, but not all Qigong is Tai Chi or Kung Fu. Qigong can just be Qigong. So when you practice Tai Chi or Qigong, and so we'll delineate them there, even though they're kind of two sides of the same coin, you typically have a form or a set of movements that is going to be 120 movements long, or whatever your form is. And that form might take you 7 minutes to complete. It might take you 30 minutes to complete, depending on how you practice and what your focus is in your breath. So what your tempo is. But you do those, we'll just say 120 movements, and that's the dose of exercise that you get. So this is a fascinating thing that here in the West we've identified. Exercise is great for Parkinson's, but then answering the question of well, how much exercise? You might have one physician that says, as much as you like. You might have one that says, 20 minutes a day. You might have one that says 30 minutes every other day, get your heart rate to 120, right? In Chinese medicine, we say these 120 movements of your Tai Chi form, and that's your dose. Do it every day. So dosing of exercise is a fascinating thing where we can see this integration between Eastern and Western models that really helps to benefit patient outcome. Let's see here, where were we? So, and then, another branch of Chinese medicine might be things like meditation or prayer, or mindfulness, right? Lots of terms that are sort of in the zeitgeist right now, but each of which is sort of capturing, in essence, the same activity, right? Different words to describe the same or similar phenomena. And then finally, in terms of what Chinese medicine is, understanding that much of its evidence is recorded in the form of case studies and clinical experience, again, dating back thousands of years. But as I mentioned earlier, research on Chinese medicine and its efficacy is exploding right now. If you were to check out PubMed and just look for articles on or papers on the efficacy of acupuncture for this condition or that, you will find many of them. And while you may have to consider publication bias and things like this, which you should do for anything that you're reading, we've got great evidence out there for Chinese medicine. So when you find people who are like, that doesn't work, well, you have a lot of reading to do then. Probably about 25 or 30,000 studies worth of reading to do. So let's talk some basics of Chinese medicine, and we'll just kind of move on from there. Chinese medicine and thought focuses, as I mentioned before, on the idea that a thing works rather than why it works. Just does it work is good enough, and then you don't worry about why. However, it is still a consistent and logical system with consistent and reproducible results. And really importantly, the system was designed to be made interpretable by the layperson. It can be super frustrating when you go in and you talk to a physician, and when they give you their diagnosis, it's either in Latin or Greek, and it's kind of hard to grasp, like, what does this thing mean? Chinese medicine solved that problem because the words that they used to capture what a thing was presenting as in the body are sort of, I guess, culturally captured in the language anyway. And so this idea of tremor, right? It's a shaking. And if you were to observe a tree in the wind, what does it do? It shakes. Or if you were to observe during the age of sail, for example, the ropes that are fastening a sail to some aspect of the ship or another. Those in the wind, those ropes, particularly if they're dry and brittle, they tend to shake, right? So this idea of wind is one that is captured just in the phenomena that you can observe around the world, or in the environment around you, and it helps make it interpretable to the layperson who, particularly at the time that this medicine was in development, may not have had a particularly profound education. And so again, the medicine and the language of it was and is designed for the layperson to be able to interpret the phenomena that they are experiencing when they are in a state of dis-ease or disease. Let's see here. It's really important to kind of get a grasp of some of these baseline terms, like what is qi and what is yin, what is yang. Qi has been probably misunderstood as energy, and it's like that is an aspect of what qi is, but qi is definitely not your Yoda lifting an X-wing out of the swamp in Empire Strikes Back, right? That's a cool interpretation, and it's sort of fun to think about it in that regard, but that's not the express aspect of qi. And so when we talk about it as, well, it works because it's an energy medicine. Like, well, you know what? Hey, man, either you're a wizard or you're a scientist. Pick one. If you want to be Gandalf, go be Gandalf somewhere else, because I'm trying to work with other physicians and help integrate medicine, and they don't want to work with Gandalf or Yoda. They want to work with another doctor. So rather than explaining a phenomena away, when I have patients on the table and they're like, why did that work? Sometimes I say, I don't know. Right? Like, I just know that it did, and I could see that that it did, but I don't know why. I almost never, unless it's a clear manifestation of what is easily identifiable and representable in our texts, that I can then point to and say, hey, look, what you're experiencing was defined 5,000 years ago or 2,000 years ago as a manifestation of qi. So what you're feeling is qi, and there's not a good Western or English description for what it is, and this is the only word we have to try to help understand it. But I never say, well, it worked because it's an energy medicine, because it's dismissive, right? And it doesn't help a patient understand, like, hey, you can rely on this to help you continue to improve. So understanding what qi is versus what it is not is, it's not mysticism. I guess I'll say it that way. And many of my critics or sort of, some of my peers that disagree with me on this, they're like, yes, it is an energy medicine, Rob. Yeah, okay, I get it. But let's first define it. Qi is better described as matter, all matter, any matter. And yin and yang, we don't say yang, we say yang. yin and yang are definitions of the state of that matter, or the state of that chi relative to other states of matter, or to use the term, other states of chi. So if you were to conceive water, for example, right? It's a good one. It's easy to understand. Water pertains to yin, but it is not yin, because just as chi is not energy, it is matter, and therefore might at some point be energy. It, it we don't think of things in the terms of and. We think of them in the terms of both, or or right. Like, so it's not and, it's or. uh, it's not this, it's both, right? And so when we think of water, yes, it pertains to yin, but it is definitely not yin, because first of all, for a thing to exist, it must be both yin and yang, um, simultaneously. So when we think of water just in a liquid state, that is pretty yin, particularly to water in a gaseous state. When we think of water in the terms of ice or as a solid, that's extremely yin, particularly by comparison to a liquid state. And it's even more yin compared to water in a gaseous state. And this is why, if you think of things in terms of like, what is their particulate nature, not particular, but particulate, like the particles that are making it up, if they are really conglomerate, if they're really aggregate, it's very likely to be much more yin. If they're really diffuse, it's much more likely that this thing is going to be in a state of yang, at least compared to something else. So if we think of water, um, I mean, generally we think of it as being cool, but water as steam is extraordinarily hot. And why? Well, the particles are moving faster, they're further apart. So this idea of yin and yang, uh, and describing states of matter is really profound. It's also describing phenomena, right? Because if a thing is moving quickly, it's yang. If a thing is moving slow, it's yin. But again, this would only matter relative to something else, right? So if you've got a really awesome Ferrari rolling down the road, it's definitely a yang car, unless it's doing 20 miles per hour and it's getting passed by a 1976 Honda that's moving at 40 miles an hour and just screaming down the road. One of them is more yang than the other. Um, so again, it's like this, like, both are in a state of yin, both are in a state of yang at the same time. And once you have this and that, I think that's as quickly and as most condensed as I could at this point in my understanding and knowledge and career. I think that's as quickly and as condensed as I could possibly explain it. And I hope it was sort of easy to follow in that regard. Um, Understanding then what the Chinese, in sort of terms of Chinese physiology and how we view the body, we have vital substances, and these are qi, blood, jing, shen, and fluids. And then again, yin and yang. And so blood is considered to be very yin, but then you have the yin aspects of the body, which are even more yin than blood. And qi is considered to be extremely yang. And so blood and qi are partners. And in this context, now we're talking about, you might have a corollary to qi being like the gases that bond to the hemoglobin, right? And if they're in a gaseous state, they're a pretty yang entity, and therefore would be much more closely associated with qi. And so this is where, and then it actually takes even a step beyond that. It doesn't have to be gases that are bonding to hemoglobin. It doesn't have to be gasotransmitters. It can be its own phenomena, a unique phenomena that is indefinable or indescribable in terms of Western medicine to this point in our understanding in the West, or in terms of how we describe or define phenomena. But we're learning new things in science all the time in the West, right? It wasn't that long ago that the mesentery and omentum were defined as like potentially new organs, and we, for 300 or 400 years, we were like, we know what all the organs are, and somebody's like, hey, check this thing out. So it wasn't all that long ago that we were like, your appendix doesn't do anything at all. And now we're like, well, actually, maybe, right? So these ideas that a thing could still be indefinable or indescribable to our terms and yet be identifiable to another culture, that's a thing that we should probably have room for. So this idea that when we talk about the vital substances and we talk about qi, Now is when it's okay to say, hey, chi might be a thing that is separate from all these other phenomena. And therefore, something like an acupuncture point may be a separate thing as part of your physiology. Um, and so those end up being fairly helpful. Um, Now, in terms of disease mechanisms, um, we have, basically just a handful of them. And again, this is where Chinese medicine defines this in interpretable um, terms for the layperson. So we have wind, and there's two types. There's endogenous wind, the wind that comes from within you, and then there's exogenous wind. So if you've got a severe allergy attack or a cold that's come on, um, those are considered exogenous, and they're defined as wind because they were brought into the body on the wind, right? Um, the wind that comes from within the body, that's of a different pathogenesis, and that's basically the one we'll focus on today as we discuss this. But the other disease mechanisms are cold, heat, dryness, dampness, and fire. And then you have a handful of what they call the miscellaneous ones, and these are things like trauma, right? That's a pretty obvious manifestation and cause of disease. So, for example, if you have phantom limb syndrome, right? Because you had a limb that was amputated either as a result of a car accident or combat or diabetes, took your foot off. Phantom limb syndrome is a common phenomenon, and it's super painful, right? Like this, and distressing, because it's like, I can see that my arm's not there, but boy, does it hurt where it's not. Um, this is an interesting thing because now trauma is a really clear cause, not just of the trauma, but of the resultant disease, or dis-ease of this pain that you just can't make go away. And the West might say, well, it's completely neurological. Like, sure, yeah, but we can maybe get you some relief. So so wind, cold, heat, dryness, dampness, and fire, and then those miscellaneous causes. So trauma, as I mentioned, we have one called food stagnation. And like, if you've ever experienced that, it's like, just the term tells you exactly what it is. It's like, man, I've got this feeling like I just can't get anything digested and I can't get it passed through. And the Chinese were like, yep, we call that food stagnation, and here's some herbs for it. And it's pretty easy to treat generally. When we talk about the meridian system, that's one theory within acupuncture, and also actually within herbal medicine as well. But it's the idea that there are connected lines running throughout your body that are able to have a specific effect through the application of some treatment modality or other, whether that's massage or acupuncture or Moxibustion or cupping, or actually many other modalities that we will employ. And that we can have an effect either on an aspect of the body or on an organ by treating acupuncture points along these lines, which basically makes a map, I guess, of the body, you could say, right? But then we have what's called Zongfu theory, which is when we're treating organs in particular. And many times we will try to integrate both theories into one consistent method forward of treating. And then there's older models for the same thing, like the 5 elements model and things like this. The real area where I think Chinese medicine shines is in how we differentiate disease. So I think we shine here because we are able to kind of parse out different presentations of the same disease. We call it a pattern, rather than rather than a disease. We call, whatever your constellation of symptoms is, we call that a pattern rather than a disease. So the Western physician might see one disease, Parkinson's, and therefore you get treatment X, which is carbidopa, levodopa, and whatever the remainder of your treatment is, right? But in Chinese medicine, we've got, depending on how you count them, like 5 to 7 different patterns, but they will always fall into the category of a liver presentation. So liver blood deficiency generating wind sounds poetic. Again, it's kind of putting these terms into a interpretable definition to the layperson. There's also liver yang, liver yang rising generating wind. liver fire generating wind, phlegm heat agitating wind. So almost the idea that there's already wind present and it's being agitated. And then finally, liver and kidney yin deficiency. Now, here's something that's super fascinating is that um, movement disorders in Chinese medicine are always going to involve the liver, and there's no exceptions to that. That is really interesting because in a system that is defined by uh, the terms or and so yin and yang, yin or yang, right? It's this idea that and is more important than or. Having a situation where a thing is now or, it's like it will always be liver. That is really significant because you don't find it in very many other diagnoses within Chinese medicine. And so this idea of it always involving the liver is one where it's like it helps us a lot because now I don't, if you come into me for a movement disorder, restless leg syndrome, or the shuffling gait and the mask and these things, particularly if you also are experiencing the tremor, these things, it's like, holy cow, man, I'm able to rule out 95% of everything else that I would look at. And it's like, well, we're going right to the liver. Now, this doesn't mean your actual physiological liver. It could, but it usually does not mean your physiological liver. It's the way that the Chinese interpret the liver system, both the organ and the meridian. But like, if you were to think of liver blood deficiency generating wind, this diagnosis, while still Parkinson's, is going to appear as a long-standing pronounced tremor of the limb, sallow complexion, staring look, dislike of speaking, occipital stiffness, cramps in the limbs, difficulty in moving, walking will be uncoordinated, dizziness, blurred vision, sweating. The conditions are all worse with movement. The tongue will be pale, thin and quivering, and the pulse will be fine or choppy. This is a really common one in men. Now, Western medicine clearly understands that women and men seem to be affected differently by Parkinson's, which often leads to later diagnosis in women because they present differently. But liver blood deficiency generating wind within our medical tradition tends to affect men much more. Meanwhile, we'll come down, we'll check out liver and kidney yin deficiency. Liver and kidney yin deficiency can affect men, but it tends to affect women more frequently. And this is going to look like a thin body, dizziness, tinnitus, insomnia, dream disturbed sleep, headache, night sweating, mental restlessness, sore back and knees, numbness of the limbs, stiff neck and back, tremor of the head, clenched teeth, and a tremor of the jaw, long-standing tremor of the limb. So this one, it's like, okay, it's consistent on both sides, right? That long-standing tremor of a limb with marked amplitude. That's the interesting part there. Cramps in the limbs, difficulty and clumsiness of walking. So now it's like we're defining the nature of the shuffling gait differently already, but it's still a dyskinesia and shuffling gait. We're just observing its manifestation and defining the manifestation itself and putting that into the box of which type of wind disease do you have, right? The staring look. So now we're back to that vacant, the mask, right? Poor memory. The tongue will be thin. It will not have a coat. It'll be moving, right? Before we said quivering, this is a moving tongue, right? And so it's this idea that instead of a shake, it's a more robust movement. And then the tongue will have a red body, particularly if there's what we call empty heat. So if you're really yin deficient, and again, we talked about yin being more associated or pertaining more to condensed states. And therefore, if you were to consider those atoms and their condensed nature, they're going to be a lot cooler, right? So if you don't have enough cold to cool down all the hot, there will be an apparent excess of heat. Now it's apparent because there's not enough cold to keep that heat in balance. So when the cold goes down, it's not that the heat actually goes up, it just feels like it did. And that's what they call empty heat or yin deficient heat. So if there's empty heat in this presentation, the tongue the tongue itself will be like a bright crimson red, almost like these drapes behind me, like super bright. And then finally, the pulse will be fine, rapid, or floating and empty. So the differentiation of how the disease presents is one area where we shine, because that helps target the nature and manner of how the treatment's going to proceed. And this is an area where this consistent logical model that Chinese medicine presents, it tends to be so very effective, and why the results are reproducible, even though we may not put, okay, two patients have Parkinson's, one has liver blood deficiency, one has liver kidney yin deficiency. Therefore, we're going to put our needles, our acupuncture needles, in different points, but in both instances, we're going to be able to help balance the dynamic, I guess we'll say, between dopamine and acetylcholine. And when we start to look at acupuncture through a Western lens and try to grasp what its mechanism of action is, we know for sure that it is extremely beneficial in reducing inflammatory processes anywhere in the body. This is why sham acupuncture, meaning like we just randomly pick a set of points and use them. Sham acupuncture is often more effective than placebo. Like if you were going to try to treat two things, one of them pharmaceutically, one of them with acupuncture, and if you had four categories for this trial, you might go, one group gets just placebo, like a sugar pill, one group gets sham acupuncture, one group gets real acupuncture, and then one group gets whatever the actual pharmaceutical would be. The sham acupuncture group, meaning, again, not the actual points that we would normally use, just randomly picked ones, often those results outpace placebo by about 10%, is what the evidence is indicating. And that's super fascinating, right? Because placebo, we know that placebo is like 30% efficacy. It's like, that's just pretty well understood. Meanwhile, like sham acupuncture outpaces placebo. And so here we are, we're like, well, we can't tell if the real acupuncture worked or if the sham acupuncture worked. So we don't have a placebo or a control. It's like, well, okay, as we continue to move forward and we see that sham acupuncture is often around 40%, this becomes pretty interesting, because it's like, well, no, we got a good thing that we can see. So hopefully that makes sense and doesn't derail us here as we kind of finish up this part of the discussion. But when we look at sort of the integration of Eastern and Western, we tend to see that if you were to view those last two groups of the real acupuncture and the conventional care or the pharmaceutical, if there was a fifth group that had both, their outcomes tend to be very, very good. And so when we look at something like Parkinsonian disorders or movement disorders, while we definitely understand that sham acupuncture or acupuncture in general is good for sort of alleviating or reducing those inflammatory processes anywhere in the body, it's very clear that acupuncture helps with the uptake of dopamine and therefore regulating the imbalances between dopamine and acetylcholine. So, which is again, sort of the characteristic attribute of the disease. And what's super cool is that, because we know that I think it's like 50 or 55% of Parkinson's patients will develop a tolerance to their dopamine and their to their levodopa, carbidopa drug protocols. So conventional care, they'll have a tolerance by about the 5-year mark. Through the use and integration of these Eastern models with Western medicine, that integration prolongs the amount of time before a patient, because you don't have to dose as high on your carbidopa, levodopa. And by prolonging the amount of time before a patient has to or experiences that tolerance, and therefore the lack of efficacy of those conventional care drugs, which unequivocally are the best. Carbidopa, levodopa, there is no debate that it is currently the best treatment model that we have. But the idea that you've got a potentially 5-year window, that's terrifying. And if we can protract that and make it a 7-year window for you, or a 10-year or a 15-year window for you, or if you've already been at that 5-year window and now we can introduce another tool that I mean, the evidence is, I think, still kind of being gathered on this, but it stands to reason. It's biologically plausible that through the use of acupuncture, you might be able to reduce the need for the higher doses of carbidopa, levodopa based on that tolerance. And so therefore, you're helping to improve that quality of life for that patient, as well as their entire family, and all their caretakers and the community that is banded together around them to help support them. You're supporting them too, because now you're able to reduce that load that everyone else has to carry, along with the victim. I mean, I don't like victim mentalities or mindsets, but it's okay to identify that someone is victimized by a thing, right? Like when I got wounded, it was somebody did that to me. And that's fascinating. Final point, and then we'll just open it up for questions. A single, I think, so I wrote a paper on this last year, and at the time, I think it was 930,000 Americans were living with Parkinson's or some movement disorder. And that is considered to be just the tip of the iceberg, particularly in a healthcare system like ours that is pretty overloaded right now, and it's hard to get appointments. It's like, how many people started developing or exhibiting Parkinson's treatments during the pandemic, and nobody knows because they haven't been able to get an appointment yet? It's probably a big number. Beyond that, a single TBI, mild TBI, increases your probability of Parkinson's by, I think it's 53%, which, I mean, that's a big number. And if you've had 2 traumatic brain injuries, I want to, it's in the 80% range. I should have gone back and looked at the paper I wrote, because then I would have been able to pull the exact statistic, but it's a big number. And while there's surely a genetic component, if you happen to be predisposed based on genetics and then you get a brain injury, probability of Parkinson's goes way up. So we are about to watch an explosion of early onset Parkinson's and otherwise in the next probably 5 to 10 years, partly as a result of our aging population, and more than that, 20 years of conflict in Iraq and Afghanistan, where the signature wounds of the war were severe brain injuries, as well as spinal cord injuries. So we're going to see this thing. We're going to see this thing come up, and so Parkinson's ends up being pretty personal to me, as a victim of an IED blast that resulted in I had 2 foci of shearing type injury in my brain, where the tissue was in essence torn apart. So I myself am a good candidate, and I sure would like to be able to help try to find a cure before I'm not able to spend my time with my grandkids or kids, or be a burden on them. And so we're watching this thing. It's about to explode. And the more work that we can do to kind of help alleviate these processes, while these miracles that we're seeing occur in Western medicine kind of advance that mission. If we can help buy them some time through the integration of these ancient methods with modern methods, man, that's a goal in my mind. So with that, I'll kind of open it up. Hopefully that kind of was informative enough. I was planning on keeping that to like 20 minutes. I have no idea what the time is actually. So hopefully we got through that okay. So I'm okay. Casey, you let me know if it's a good idea. We just go ahead and just open it up. I mean,
Yes.
Yeah, it doesn't matter if you raise hands or just come on.
That was very comprehensive. Thank you.
Sure.
Dr. Bibeau. There are a few questions already.
Okay, great. Let's see.
In chat.
So for Sandy, Sandy said, thank you for your service. I guess we'll just start with Sandy. Thank you for being a patriot that's worthy of defense. That's here we are in a republic, and the idea that we can govern ourselves is it is still unique in this world. And I'm really grateful that there are still Americans out there who cherish their liberty enough to say thank you to veterans when they meet them. So I think that's wonderful. Thank you. Okay, have I had success treating tremor with acupuncture? That's Paul. Yes, I have. And many times I can get a result on the table. So for example, one time I was treating a Parkinson's patient, and her tremor just kind of started while she's there on the table. And so I put in 1 needle. Now I already had some needles in because I was treating her for actually some other things that day. But the tremor began. I went ahead and put in a single needle at large intestine 10, which is on the forearm, about 2 inches down from the crease of the elbow, and the tremor stopped immediately. So it can be that fast. When I was still when I was an intern and going through school, I had a patient who had just horrible restless leg syndrome. And at the time, even though I'd read a lot about it because I was in school, I still perceived restless leg syndrome as like just discomfort. I had not made the the mental connection that it was indeed a movement disorder. And the first time I saw it, and I saw this sort of like wave or roll of the tremor throughout her body, and it was crystal clear. My God, she is really suffering. And I used a technique called Moxibustion, utilizing what's called a belly bowl. And I moderated it through salt, because the point that was used is Ren 8, which is basically your belly button. You never needle it. And if you're going to do Moxibustion there, you usually need some sort of insulator or moderator. And I don't know why this is, but for some reason or other, salt is a commonly recommended moderator or insulator. So I basically just poured table salt into this gal's belly button, put the belly bowl with burning Moxibustion on, and her tremor went away immediately. Now, this is where, I mean, here I am. I'm the guy that was criticizing everybody else. Is like, you're not Gandalf. Don't be a wizard. And I have no idea why salt and Moxibustion have that effect. I cannot explain the mechanism of action to you. I didn't conceive this on my own. I pulled it from a textbook that has a 5,000-year-old tradition behind it, and I watched it be effective. So to answer Paul's question, have I had success treating tremor with acupuncture? The answer is yes. And I've been able to get sustained results. So it's, hey, I put a needle in, tremor goes away. And I've had instances where patients have not had their tremor over a 2-week interval between when they saw me last and when they came in. So that's, hopefully that answers your question, Paul. Let's see, Karen. Let's see, Karen, could it be said Chinese medicine looks more at Parkinson's disease as a whole body disease than traditional medicine? Yeah, absolutely. So in fact, the textbook I mentioned, Ted Kapchick's Web That Has No Weaver, this book is often recommended as a primer for Western physicians who are kind of trying to explore and understand Chinese medicine. So it's a really wonderful book. But his idea, the title, The Web That Has No Weaver, it sort of captures the idea that not only are our bodies, but the entire universe is this interwoven web. Everything is connected. And sometimes, like, to help grasp this idea, it's easier to observe the phenomena around us. So there's 2 models that I sometimes use. One, a sort of a cultural model, sort of a 7 degrees or 6 degrees of Kevin Bacon thing. And then the other is like, have you ever been, maybe, I don't know, cutting up some steak to cut little strips of steak so that you can grill it on, throw it in a pan or sear it, whatever. And you have those strips of fascia. It can be difficult to identify really where the fascia ends and the flesh begins. You can identify that it is different, but where, right? As you start to look closer and see, like, where does this thing transfer? Where is the line that it is no longer the thing that it was before? Well, it's so interwoven that identifying that demarcation of it's no longer the thing that it was before is really difficult. So the thing is woven. And so when we talk about whole body and viewing Parkinson's as a whole body thing, the answer is yes, but it's because the Chinese medical tradition and worldview identifies as the thing is already one and the same already. It's not compartmentalizing different parts and saying we're going to treat just this part. It's looking at, we're going to treat the whole machine, all of it. And then the other example that I use of just to demonstrate like how we're so connected, I kind of like to be able to teach sort of using allegory or things like this, where one thing that's not related at all kind of helps us to understand a different phenomena. So like, think of this. So a lot of times I take my kids to meetings of the Military Order of the Purple Heart, which in the intro, Casey told you that I'm the national surgeon for MOPH right now, and I'm also the department commander. So I run the Military Order of the Purple Heart as its commander for the entire state of New Mexico. And I really love taking my kids to these meetings. And when they were a little bit younger, we still had a lot more World War II veterans around still. And one thing that I realized a few years ago, just in terms of how closely we are all connected, is that, just as our bodies are connected in themselves, we as a society are also really, really much more connected than we realize. Because it struck me one day that I had my kids at this meeting. They were 6 and 2 at the time. And one of these World War II veterans was shaking my hand's son. And it struck me that when that World War II veteran was the age that my son was at the time, the most powerful and prominent veterans service organization in the country was an organization called the Grand Army of the Republic. Now, this has nothing to do with Parkinson's, other than demonstrating how closely related we all are. But this idea that this guy, who shaking my son's hand, when he was the age that my son was at that moment, the most prominent veteran service organization wasn't the VFW, wasn't the American Legion, it was the Grand Army of the Republic. And in order to be involved in that order, you had to have been a member of the Union Army fighting during the Civil War. And so here my son was shaking the hand of a guy who, when he was, 80 years younger, well, actually probably 90 years younger at that point, he may have shook the hand of a guy who had lost his arm to a cannonball at Gettysburg. So we are all much more connected. Here we are separated by, 160 years or more. And my son was shaking the hand of a guy who had shook the hand of somebody who had fought, in the Civil War. This is an amazing thing. We are all much more connected than any of us ever realize. And even deep into our history, we are connected. And your body is no different. So the way your body interrelates with itself, it's like, okay, the ankle bone is not connected to the neck bone, but oh yes, it is, right? So hopefully that analogy helps make that make sense. Okay, Norma says, understanding of carbidopa levodopa is that in past decades, MDs were reluctant to start it early because it would lose efficacy, but that hasn't proven true. So haven't been starting it much earlier. Thoughts? So let's see. I could probably come back and try to find this stuff. So it was, if I'm remembering correctly, the paper I wrote last year indicated that it was a paper that was published in 2018, and I want to say it's 50%. It's around the 50% mark of patients that develop that tolerance. So, and then there's a question of like, how long until the remaining 50% that didn't develop a tolerance, how long until they do, and will they? That's a separate question. So I guess, Norma, do you want to just come on and kind of help me fully understand your question so I can answer it as accurately as possible?
Yeah, I guess because I was started on it right away at 67. I'm wondering, um, what the expectancy of it being efficacious for me, and others who have started it in their 50s or 60s, because the doctors seem to be promoting these days going ahead and starting it as soon as you're diagnosed and have the tremor and so on.
Yeah. So I don't. Identifying how long you can expect before there's a sort of a degradation of efficacy as you develop a tolerance, that's hard to say, and it's because, well, I guess you'd have about a 50-50 shot of being in the group that's going to have it affected by around the 5-year mark, and you got a 50-50 shot of not being in that group. And so it's really difficult to say. How old are you now? I mean, a gentleman doesn't ask, but
I just turned 70.
okay, so you're at about the 3 or 4 year mark now. Um, have you started to? I guess I would start to look at, okay, have you had to start adjusting your meds or increasing the dosage? And one thing is, my understanding, I was recently talking with a neurologist who I think very highly of. And we kind of talked about this. Mostly it was because I kind of wanted to just pick her brain and you know, see if I could kind of sharpen my own understanding of the disease by talking with somebody who I esteem to be an expert. And it seemed like it was fairly clear that it's the idea that you can titrate the drug as you go. And so, sure, you can, in years past, it was, hey, let's not start you off on this until X amount of time, because let's say you're diagnosed in your 40s. How long until until the disease has advanced so much that you're not going to get an effect. So the timing of when you start the drug is important. But as I understand, we tend to see somewhere in about the 60s or early 70s is when it starts to really affect somebody. And so here you are right in the timeline of where it's going to happen, is when your diagnosis occurred. And so the ability to titrate that drug to either increase or decrease the dosage as necessary in order to help keep a benefit is part of the answer to the question. I think the better way to look at this, though, is what adjuncts can you engage in order to help that eventuality, should you be part of that 50%. What activities can you engage in to delay the onset or the degradation of the efficacy of the drug as long as possible? And some of those would be things like appropriate exercise in appropriate dosing. And so maybe for you, it's not going to be Tai Chi, it's going to be swimming or cycling or walking, right? Whatever it is, hiking, whatever it is for you. Maybe also incorporate some gardening, so you're getting out there and getting the sunlight that you need and doing the things that are also going to help keep you active, because we're like concrete, right? Like as soon as you quit stirring concrete, as soon as you quit moving the concrete, it dries out. Well, we're like that too. And as soon as you quit moving, you dry out, and that's it, you die. So the more movement, the better. And while you should have dedicated exercise, including other things that are activity, is going to be really, really beneficial for you, because those also help balance that acetylcholine and dopamine sort of relationship. And then I would say engage in these other modalities on a semi-routine basis. I mean, I think once monthly acupuncture would probably be really beneficial for you, provided that you find somebody that is a scientist and a physician and not a charlatan. And if you can find that, I think you probably are doing all the things you need to do to prolong the timeline before the drug would become less effective for you. Hopefully that answers your question, Norma.
Thank you.
Sure. Claudia asks a really good one here. How long does the effect of acupuncture last? So this is really fascinating, because sometimes it lasts for ever. Sometimes it lasts for not that long, and it ends up being a sort of aggregate benefit. I have a patient that I've been working for, diagnosed with ankylosing spondylitis in, I think, the very early 70s, something like that, and been working together for about 5 months, somewhere in that ballpark, I guess. And we've started to see this patient have significant relief, much less pain. We've been able to start working on other things besides his ankylosing spondylitis. The other day he comes and he says, "Hey, check me out. I'm standing taller," and that was really fulfilling to see. But I will tell you, in the earliest days, there was a part. I'm a little bit like cocky, right, in terms of like treatment. Like I have pretty good results, and so while I think I'm charmingly arrogant, I realize I'm still arrogant. And this was a guy who was like giving me something of a fall from grace, because I really initially felt like, man, like this guy's a puzzler. I'm not really getting the results that I wanted to get. Now I didn't really think I was gonna, reverse 50 years of disease pathogenesis in a handful of treatments, but I thought I was going to get better result than I did initially. And now here we are, so several months in, and we're starting to see really profound results for the guy, and it's really, really rewarding and fulfilling. I have another patient who I don't see her anymore. And I mean, I guess there is the possibility that she was like, this guy's a quack, and just like left. But the reports I got were really, really positive. And it was hey, we will call you the next time we have a case of the sniffles, which I mean, I think that feels like it's a pretty promising thing, that I'll see them again when they're sick. But the things we were working on, completely resolved, and I don't need to follow their care anymore. And I'm looking forward to getting a phone call from them someday, and they come in and I say, hey, how's your, again, to maintain all the privacy, how's the thing that we were working on? And hopefully they say, yeah, and haven't had it again. I've had instances where I had patients that I treated for chronic seasickness, right? Like her husband loved to travel, and so he would always take her on these cruises and stuff, and she would always get really, really sick. And alls I did was 2 sessions of acupuncture and prescribed her a formula called Wo Sheng Zheng Qi. And now she no longer gets motion sickness or seasickness. And so she's been able to go travel and have fun and do those things. But I don't see her anymore except for when she needs me, because she like recently I heard from her because she stubbed her toe, and it was actually pretty severe bruising. So she came in and I gave her a treatment and helped relieve the pain, and haven't heard from her since. That was about a month ago, a couple weeks ago, something like that. So ultimately, to answer Claudia's question, oftentimes it's going to be an aggregate experience where you kind of have to build towards that set of relief, and that could take 10 to 20 treatments. Oftentimes it's going to be I see you once and I don't have to see you again sort of thing. And it does depend on the disease. It depends on an array of factors that are specific to you. With Parkinson's, I tend to get notable result by the 3rd treatment. And by the 8th treatment, we're basically moving into a let's manage this kind of position, and that tends to be my ballpark, right? So 3 and 8 are the numbers that I'm kind of identifying in terms of when I start to move you to okay, I'll see you once a month now. Okay, now I'm going to see you once every 6 months sort of scenario. So hopefully that answers your question, Claudia. Sandy took off to a meeting there. So Ron says, recently read of a case where a Parkinson's disease patient had their PD go into remission, and the only thing they could tie it to was his practice of meditation over many years. Have you ever heard, read of, seen anything similar? Also, is basic meditation similar in effect in any way to Qigong? Okay, so yes is the answer. I had a Parkinson's patient who I had treated, I think, around 12 times. Somewhere in that ballpark. And just before Christmas, they didn't make it to an appointment, and they never ever missed. If they were running late, they would call. So when I didn't hear from them or see them, I worried about it. I resolved to give them a call the next day. They called me instead, said, "We're sorry we missed you. We're not going to be available for a few weeks. We'll get back to you when we can." After the new year, it had been several weeks. I hadn't heard from him. I was really deeply concerned. So I gave him a call, and I talked with my patient's husband. And he tells me that just before Christmas, his wife had had a TIA, a transischemic attack, a mini stroke, and that had landed her in the hospital. While she was there, she was being evaluated for days and days, and I think like 4 days that she was in the hospital. And a young neurologist who's at that hospital came in, and he sat with her for apparently hours. Spent like 2 or 3 hours, and then did it again, I guess, the next day. If I'm remembering the story right. Basically, this neurologist spent a lot of time with this lady. Now, over those 12 treatments that I'd had with her, we had seen that her tremor was becoming less and less prominent. The first day I met her, she absolutely had the mask, and it was crystal clear that her disease had progressed significantly. And the neurologist ends up saying, that was when I first had begun treating her. Now, over the ensuing several weeks, she had fewer and fewer neurogenic orthostatic events. So the syncopal events that are common in Parkinsonian as it is advanced. So she was having fewer and fewer of these type of incidents. she did have 2 falls during that time, which was interesting, but fewer and fewer syncopal events, fewer and fewer instances of the shuffling gait. She actually had reached out to her neurologist, who is a well-known neurologist here in New Mexico. Um, and I don't think this neurologist probably would have missed the mark, right? I don't think that neurologist who's got such a great reputation would have been like, here it is, you got Parkinson's, but was wrong. I just don't see that, particularly because I saw the disease when she first came to me, and it was absolutely textbook, but it was that liver, kidney, yin deficiency presentation, really thin body, the shuffling, the dyskinesia, the shuffling gait, all of it. So she goes into the hospital after this transischemic attack and spends, quite a bit of time in there. This young neurologist spends quite a bit of time with her. And after a couple of days, he says, "You do not have Parkinson's disease, and I am taking you off of all of your medication." And so I was pretty stunned by that. And I asked the husband, I said, how long ago was that? He said, well, that was like the week after we missed our appointment with you that happened. So by this point, my patient was probably 4 or 5 weeks, something like that, into no medication. And she had had no instance of tremor. She had had no instance of the mask. She had no instance of basically any representation of the disease. I joked with the husband. I said, well, I don't know if I'm that good to cure her. And he laughed and he said, well, it crossed our minds. I ended up talking with the cardiologist who had initially referred this patient to me. And she was like, hey, it would not be unheard of for this disease to go into remission, predicated on the introduction of other things. And I definitely do not want to come off as taking credit for like, I cured her. That is not what I am suggesting. These things go into remission. You've got cancer that will spontaneously go into remission. You've got, many diseases that just spontaneously resolve. But it sure is interesting that after years and years and years with the disease, introduce the acupuncture, and maybe it was just the perfect storm for things to work out for this patient. But to my knowledge, she doesn't have Parkinson's disease. And if that's really the case, it's like, man, this is really, really wonderful, because it suggests that there's a good chance for all of us, right? And it has to do with the integration of these medical models. It definitely deserves a good look. Maybe that neurologist was wrong, and maybe it was the drugs themselves causing these symptoms. That's possible. But it sure is a fascinating case. So to answer your question, Ron, yep, I've definitely heard of instances of Parkinson's disease going into remission. When you have this sort of thing, it's like, well, let's take a look, because other people are depending on us trying to find an answer. In terms of meditation, as I mentioned, meditation is one of the 8 branches of Chinese medicine. And in fact, it's considered, we actually consider acupuncture to be sort of a really finite aspect of the medicine, which is interesting, because it's a huge body of knowledge. But it's finite because you're not supposed to do it very often for yourself. Instead, you're supposed to meditate, you're supposed to exercise, you're supposed to eat right, you're supposed to properly sleep, right? You're supposed to do all those things that in biomedicine we already know and recognize as well. So because of that, it's kind of like, well, those are the big portions of the medicine. And in terms of like, is meditation similar to Qigong? There are several of my peers, and I do fall into this category myself, that Qigong is, or at least can be, moving meditation. And it's not that Qigong and yoga are like one another. You could absolutely make the case that yoga is a type of Qigong. So for a thing to be Qigong, you need 3 things. Consciousness about your breath, or like an awareness of it, and a focus on how are you breathing? What is the breathing process. You need movement. Fascinatingly, stillness can constitute movement. So if you're holding like a yoga pose for a long time, even though you're still, but you're holding that pose, that constitutes movement. And then a dedicated mental focus, not focus, that's not a word, focus, a dedicated mental focus. So in essence, focusing on the thing that you want to focus on. In the tradition of Kung Fu and Qigong that I am a teacher of and a practitioner of, oftentimes when we focus on meditation, it's not this idea of like clear your mind, which is super hard to do, by the way. Like, if you ever tried to like think of nothing, it's like hard to, apparently the only time I'm good at thinking of nothing is like on a long drive while my wife is trying to talk to me and I've like tuned her out because I'm just in a state of like complete mental disawareness of anything but the road. That's about the only time I think I can keep my mind clear, and it's totally unintentional, right? Like, so I think we view it as focus on the thing that you want to focus on, and I suppose if the thing you want to focus on is nothing, I guess that's clearing your mind. But what if the thing you want to focus on is you want to sit there and just envision the front door of a home that you intend to buy, right? That's meditation, right? What if you want to sit there and focus just on imagining no tremor at all, right? Not imagining on the tremor going away, but imagining that there is no tremor, right? If that's the focus of your meditation, and you're doing it while you're practicing Qigong, then yes, meditation and Qigong are very similar in not just in any way, but in every way. So I hope that answers your question, Ron.
I'm Steve Sachs. I have a couple questions.
Yeah, go for it, Steve.
I'm very good at chat, and I apologize if I'm jumping in front of somebody, but you can holler at me later. What does insurance cover?
That is a good question. And the best answer is it depends. Currently, Medicare covers acupuncture, but my understanding is only for low back pain. And in some instances, a licensed acupuncturist may not even be the one who can provide it, or can only provide it under the care of an MD or under the supervision of an MD. So this, Steve, what you've asked about really is the dark side of medicine that they don't really brace you for when you're in med school. You don't realize what this system is going to look like. And it's not that it's really a villain. Like I said, dark side, and everybody's mind went to like Darth Vader and Palpatine, but like that's a lot of Star Wars references today, by the way. You could tell I'm a dad of like young kids that are, and also just of the generation that love Star Wars, just also. But it's, when I say the dark side of medicine, I'm not implying that the people working there are villains. I am implying, and have no qualms about implying, that trying to access care, even care that is well identified as being effective, can be extremely difficult when you have people who are not practitioners, they are not scientists, they are not physicians, trying to dictate what type of care you will get. And that is something that really, really frustrates me in my capacity as the surgeon for the Military Order of the Purple Heart. It's something that I'm working on really diligently, right? So I want to see you be able to get routine acupuncture for your Parkinsonian or your movement disorders, so that we can help integrate that care for you, and you don't have to go broke trying to do it. And the reason I want to do that for you is because I want to do it for you whether you're a veteran or not. Because did you know that only 30% of veterans get their care at VA? It's about 30%. Actually, it might be 28% as I think about it, but it's not a very big number. And that means most veterans are getting their care through Medicare and Medicaid. And so because I want to see them get taken care of, by opening up Medicare, opening up acupuncture and Chinese medicine through its entire array of medical modalities and traditions to integrate with Western physicians. I want to see you be able to have insurance cover this in the same way that it would cover any other aspect of your care. I want to see this happen through the remainder of the medical establishment as well, because I think that we can reduce their costs significantly, and we can improve your outcomes significantly. And I want this to be something that is done by doctors of Oriental medicine and licensed acupuncturists, because your MD doesn't have time to go spend 3 to 7 years in an acupuncture program to learn how to do the medicine properly. It is entirely within my scope here in New Mexico. We have a really broad scope of practice here in New Mexico. It's entirely within my scope to perform what we call bone adjustments, or bone setting is actually the Chinese term. Its closest corollary would be chiropractics. You know why I don't do any kind of chiropractic? Is because there's a really great chiropractor just down the street from me. And when he needs something, or when a patient needs chiropractic, I send them to him. And while Chinese medicine is really good at treating certain types of cardiac events, I don't try to treat heart attack, because there's a really wonderful cardiologist I send my patients to. So in order to get acupuncture more available to patients through insurance, it seems to me like this is a thing that has to shift culturally and legislatively. In 2017, alternative medicine practices, so primarily acupuncture, was a $37 billion industry. And when it's in essence almost exclusively a free market, because patients are coming with usually out of pocket to pay for those treatments, that is an indicator that the populace is demanding access to acupuncture, and we probably ought to do more than just low back pain through Medicare. Now, a lot of acupuncture, or a lot of the sort of non-governmental marketplace of insurance, they are starting to kind of catch up on this. They're becoming aware of how much market share they lost. And so they are beginning to cover a lot more acupuncture. And I think some plans are like, 20 visits a year that they will cover. And that is pretty good, because that's basically twice a month, right? Or thereabouts. So that's pretty good. And some plans are 20 visits per chief complaint. So I might get 20 visits with you for your movement disorder, and I might get up to 20 visits with you for your knee pain, which is, that's really wonderful. So I wish there were a shorter answer for that, Steve. And I wish I could be more concise in it, but the best way for me to say it briefly or breviloquently would be that it depends.
Thank you.
Sure. Let's see. Anything else? I've got a huge part of the day here, so it's like,
This has been wonderful. Any last questions before we let Dr. Bibeau go heal some more people?
Oh, let's see. Oh, Norma's got one she put up. So Norma's brother-in-law was in the Seabees in the 60s and turned down by the oh wow, 15 to 20 years ago. He's just now been told at 79 he will be accepted, and the savings in insulin alone will be over $600 a year. Oh wow, God. So my goodness, that is I am stunned by that, but I'm not surprised by it, Norma. During the pandemic. So right now, one of the things I'm doing with Military Order of the Purple Heart is we're conducting a survey of every Purple Heart recipient, or at least every member of our organization in New Mexico, all of whom are Purple Heart recipients. And what the thrust of this survey is basically, what was the nature and quality of your care at VA for non-pandemic related care, so non-COVID related care during the pandemic? I'm a scientist and I will report the data, but I have to say that preliminarily, it is not looking very good for VA. And I'm not doing this to put a stick in their eye. I want them to have a tool to see what, what their end end user, what their client experienced. Because anytime you read an article about VA in the newspaper, it's almost always really bad. But if you read an article about VA that VA published, it's always really good. And I suspect that the truth is somewhere probably in the middle. I know myself, I needed a cancer rule out during the pandemic. And I was told that it was going to be a 9-month wait. It was like, my God, I will be dead, right? Turns out I didn't have cancer. I used my wife's medical insurance and went to a local hospital and sought conventional diagnosis and care. And turns out I did not have cancer. So that was wonderful news, obviously. And then when the VA finally called me to tell me about my appointment, I was like, "Are you guys surprised I'm still alive?" And they weren't really in on the joke. They didn't get why I thought that was funny. They just thought I was smug. But I went to the appointment anyway because I figured I better keep it because I might not get to see him for 9 months again. But that was super frustrating. So, and so Norma, I'm not terribly surprised.
Well, look, things like that.
Was that what he said?
Dr. Bibeau.
Yes.
Hi, and thank you so much for this really great overview and all the really intricate little bits of information that you provided us. If I kind of had to nutshell this, could one way of looking at Chinese medicine be that it helps the body help itself?
Oh yeah, you could absolutely say it that way. That's a great way to put it, actually, right? Like trying to just get things out of its way to heal, right? Like the human body is remarkably good at healing, remarkably good. There's a book titled The Body Electric, and in this book, I remember a specific passage that it just amazed me, where children below now I don't know what the evidence for this is. I didn't go in and look at like the guy's bibliography or whatever, or notes or what. I didn't check that. So I don't know what the validity of this is, but the claim that I read in the book, and I had no reason to doubt it, was that children below the age of, I think, like 6, they could cut off the tip of a finger, and as long as it's like more distal than this last joint, anywhere in here, the entirety of the finger will regrow. And it is like, but it has to be a nice clean cut, right? So like the other day I was, I've got these really beautiful mulberry trees. I've reached an age of life where I'm like concerned about my trees out in my front yard, right? Like, it's like, so I'm not too far away from yelling at the neighborhood kids to get off of my grass, but I had this mulberry out front that like was overgrown. It had a lot of dead branches in it. And I was just like, I'm going to do this myself, right? Like no reason to call somebody to do this. I'm young enough to climb a tree with a chainsaw, right? So I go up there and I start cutting these branches off. And it was really rough cuts because I am not a woodsman, apparently. And so we ended up having to bring somebody out to do it. But apparently, just like the cut for the finger, if that finger's all mangled, that thing is not going to regrow. It's going to end up being just club shaped for the rest of that young lad's life. So the other 90 years that he gets on the planet, he's got a, his pointer is going to be real clubby. Well, if you get that clean cut on that mulberry tree, it completely regrows and encapsulates and treats the wound. And then it will start growing new branches and thrive, right? The same is true of like our regenerative capability in our body. And so I think that, Karen, I think you really could make the case that just as the idea of like, okay, let's go ahead and cut the rest of this finger off, but make it a super clean cut because your kid is 4 and that thing's going to regrow. Same as the mulberry tree, same as our bodies. If we can just get ourselves out of the way and allow the body to heal, it will do a remarkable job healing. So yeah, I guess that would be a good way to nutshell that. That was really cool. So, and I haven't thought about that book in a long time. So thanks for, it's one of my favorites. Let's see. That was a great question. Anything else?
Yes.
Okay.
Could, under the umbrella of all this, is Chinese medicine also looking at the gut microbiome and the psychobiome?
So there's a lot of really good work being done by a doctor of Oriental Medicine, Andy Miles. He's got an interesting podcast called Botanical Biohacking, and the short answer is yes. Chinese medicine unequivocally works at a microbiome level, and in fact, like there's this idea that like why do we see so much going on with probiotics right now? Well, it's because what you were trying to do, or even things like fecal transplants, right? Like people are all the time like, oh, okay, you need to lose weight, have a fecal transplant. Now, to me, there's this part of me that's like, I don't know, maybe. I think through the even if the evidence is good for that, I think I like the idea of like making the shift, yourself, through your own habits and changes. But the idea that if you're feeding your gut microbiota steak every night, and therefore you're going to end up with high cholesterol and heart disease, and the moment you try to go away from steak, all those microbiomes are screaming at you and influencing the chemistry of hormones and the chemistry in your brain and saying like, nope, give us the steak. And so it's like, these little colonies of bacteria are basically making your decisions for you. I think that's a pretty interesting take. And indeed, like, when you see somebody start to make those healthy changes, it's like they get to a point where like they are now, instead of craving a steak, they are often craving avocado or whatever. And it's because they've been feeding that bacterial population, which starves out the bacterial population that's demanding the unhealthy things, right? And that shifts your outlook. It changes your perceptions. It changes your desires. So, and when we start looking at herbs do that really, really powerfully, right? And in fact, like for strep throat, we tend to, we don't call it strep throat in Chinese medicine. It's usually toxic heat of the throat, or heat toxin. And so the herbal formula we use is one called Puji Shaodu Yin, and it is remarkably effective. Now, it's not an antibiotic, but it treats strep throat really, really, really well. But it won't treat bacterial infections, say, in the urinary tract. So that's super interesting. It's like, why doesn't it do it? Why does it do it in one part of the body but not in another? Is it because of the type of bacteria? Doesn't appear to be. So why is it just in the throat that this formula, well, the throat and the head, why is it just there that this formula is effective? We don't really know, but we know that it is effective. We also know that unlike antibiotics, it doesn't wreck your gut microbiome. So that's really interesting. And it's like, well, why is that? We should probably look into why that is. So, and what's also cool is that like some of these super bugs that get really bad and antibiotic resistant, with the use of Chinese herbs in particular, but the integration of herbs and acupuncture in conjunction with antibiotics when they are necessary, appears to have higher outcomes of completely eradicating that bacteria. So this is effective in the treatment of like venereal disease, all the way to other, sinus infections, etc. So fascinating. Yeah. Hopefully that answers your question, Karen. Sure thing.
Great. Thank you so much for your time, Dr. Bibeau, and for everyone and your participation and wonderful questions.
This was a lot of fun. So I hope we get to do this again sometime. I'd like for you to consider me a resource. Here I am all the way out in New Mexico, but it's a smaller and smaller world every day. So I hope you'll consider me a resource, all of you. I hope that you'll look into finding an acupuncturist out there in your area, and I wish you all the very best outcomes.
Thank you so much. Have a wonderful afternoon.
Excellent. Thank you.
Thank you very much.
Bye.